Hello, welcome everybody to today's webinar related to health information technology. We are really excited to have Erica Marshall with Florida's E-FORCSE, Florida's PDMP program here with us today. I do want to cover a few housekeeping items before she gets started, and then I am also going to share a little bit of information about what's going on with the agency in health information technology and how it relates to the PDMP program here in Florida. My name is Pamela King. I am the Health IT Outreach Coordinator here with the agency. I do want to let you know you are all, as you probably heard, on mute until the question and answer segment of the presentation. If you do have a question, or if a question arises as Erica is going through her presentation, please go ahead and type your question in the question pane so that we can go through and try to answer questions, as many questions as we can. I will tell you that we have a lot of people on today's webinar, so we may not get to all of the questions that you have. If we do not get to the questions online, what we will do is take those questions, formulate the answers to those, working with the folks at E-FORCSE, and get that answer back to you after the webinar is over. Just so you know, we typically have a lot of questions about whether we are going to be sharing the presentation. The presentation will be shared with those that are in attendance. We are also recording this presentation, and we will send you a link to the recording as well. There are also 3 documents that have been provided in the attachment pane. You can download those documents, and I'm sure Erica will touch on what those documents are as we move forward with the presentation. I did want to share with you just a little bit of information about the agency and who we are, what we are doing. Most of you know that we are the Medicaid program for the state of Florida, as well as we regulate healthcare facilities. In addition to that, we provide information and guidance on health information technology that impacts healthcare in the state of Florida. We have several initiatives. Right now, we have our Health Information Exchange Service, our e-prescribing services, electronic health record incentive program, and telehealth that we share information about throughout the state of Florida. While we are talking about controlled substances, and I have the attention of so many people on this webinar, I do like to remind practitioners that the ability to e-prescribe controlled substances is available now. There's no prohibition to that, and we are working to try and increase the use of e-prescribing for controlled substances as a way to reduce issues with prescription pads and inappropriate use of or stealing of those prescription pads for inappropriate use of controlled substances. Here is just a snapshot of where we are in the state of Florida versus other states related to enabling the use of controlled substances in the state of Florida. We are growing. However, you can see that we're fairly well behind other states as it relates to prescribing of controlled substances. If you want more information about that, you can always go to www.fhin.net to get more information. Also, for those of you that are participating in the EHR incentive program, doing meaningful use, we are of course, sharing information related to the PDMP because it is considered a public health registry. So some of the information that Ms. Marshall is going to share with you will be ways and that you can check the registry and that be counted for the Meaningful Use program. Without further ado, I do want to introduce Erica Marshall. She is the Program Outreach Director for the Florida's PDMP called E-FORCSE. And she has many years of experience with the Department of Health. She's been there for 14 years now, or over 14 years in many different roles. She was the Program Operation Administrator for the Florida Board of Pharmacy and also worked with the Drug Devices and Cosmetic Unit when it was part of the Department of Health. And of course, her most current role is with E-FORCSE and working with stakeholders to learn more about the program and how it affects them. So without further ado, I am going to turn this over to Erica. And Erica, you should now have the screen. We just need you to show your screen.
Okay, give me just one moment. Okay, great. Good afternoon, everyone, and thanks, Pam, for the nice introduction and for having me on the call today. We're really excited to share this news about moving forward with EHR integration. I am also going to provide just a little bit of information about, what happened there? I'm going to provide just a little bit of information about the 2018 legislative activity, which is impacting the prescribing and dispensing of controlled substances in Florida, specifically as they E-FORCSE program. And then I'm going to provide a pretty high-level overview of what our E-FORCSE EHR integration looks like in Florida. I do want to let everyone know that if you're not already familiar with this webpage, it's an excellent resource. The department has developed a website specifically for House Bill 21 implementation. This is a screenshot of the main page, and as you can see, there are several tabs for profession-specific information at the bottom, as well as some key topics there at the top. In the middle of the page, you have a link to the laws of Florida, as well as frequently asked questions that would apply to all of the professions. So all of the board offices and the prescription drug monitoring program work together to develop the content for this site. And I think if you take the opportunity to review it, many of your questions will be answered here. But certainly, as you can see at the bottom of the page, there's also a link to send an email. And all of the board offices and our program are reviewing those emails and responding directly to them. So please do take the opportunity to review this site when you get a chance. So first, I'm just going to talk about some of the legislative changes that occurred during 2018, which impact the program and therefore may impact some of you. Maybe not action that you have to take, but changes that you may see within the system. We did have some changes to the information that must be reported for each prescription dispensed. And we hope that this information will be helpful to our users when they're reviewing their patients' information. This includes the number of refills authorized for each prescription. Currently, we're only collecting whether a prescription is new or a refill, but now we will know how many refills have been authorized. We're also going to be collecting the telephone number for the patient, as well as the identification of the patient or other person who picks up the prescription. And lastly, to assist us with compliance and ensuring that pharmacies and dispensers are correctly reporting their dispensing information, pharmacies will now be required to report their permit number. More broadly, and what will likely impact many of you, is the requirement that E-FORCSE, or the Prescription Drug Monitoring Program, be consulted prior to prescribing or dispensing a controlled substance in Schedules 2 through 5. There are a couple of exceptions to this requirement. That is if the patient is under the age of 16. The reason being that we don't actually have records for patients under the age of 16. Non-opioid Schedule 5 prescriptions don't require a consultation. and if the system is not operational as determined by the department, or if the practitioner is unable to access it due to their own technological or electrical failure. If any of these circumstances exist in terms of the technological failure or the electrical failure, no more than a 3-day supply may be prescribed or dispensed if it's not consulted due to non-operation. And the reason for not consulting the program must be documented in your medical record or dispensing system. Failure to consult the PDMP does come along with some disciplinary action. The first failure will result in a non-disciplinary citation by your regulatory board, with subsequent actions resulting in additional disciplinary action. Those disciplinary guidelines are all set forth by the individual board offices. So you would need to consult with your board office for additional information. We are expanding the reporting requirements for what's reported to the Prescription Drug Monitoring Program. Historically, we have had Schedule 2 through 4 prescription information, but with the legislative change, we will also now have Schedule 5 information as well. And also, the bill brought the state-controlled substance schedule into conformance with the federal schedule. For about the last 8 years or so, there have been a handful of drugs that have been federally scheduled that we were not monitoring because they weren't on our state schedule. Also, a record retention schedule was imposed. Data older than 4 years will now have to be purged from the system. Additionally, we do have an administrative rule which limits access to information in the system to a period of the most recent 2 years. And what we're all here to talk about today is Authority for Electronic Health Record Keeping Integration. We're very excited about this, and this sort of goes hand in hand along with the consultation. We'll certainly make that consultation more effective and efficient if the E-FORCSE information can be integrated into the electronic health record within the clinical workflow. And then lastly, we have received authority to participate in reciprocal interstate data sharing with other states. So historically, we've had an agreement with the state of Alabama to receive their data, but now the state has given us the authority to also share Florida's data, which will broaden the pool of prospective states who will be interested in sharing information with us. So we anticipate that beginning September 1st, we will be having access to information in both Alabama and Kentucky. And then as the months go on, we will add on some additional states, and you'll see those appear in your query menu. Some additional improvements that we're making are, as I just mentioned, integration into the workflow, as well as interstate data sharing. And we're also working on 2 additional features through some grant funding that we've received, one of which is a prescriber report card feature, which allows the prescriber to compare their prescribing habits to those of who have a similar practice within the same specialty. And then we're also going to be rolling out a feature called NARCare, which is a data analytics tool that overlays on top of E-FORCSE data to help the prescriber quickly look at the data and be able to make some decisions. So in terms of the EHR integration, we are working with our service provider, Apris Health. And for those of you who are current system users, you'll be familiar with that name, Apris Health. They're our current vendor for our prescription drug monitoring program. They provide our operation, hosting, maintenance, and support of our current program. And we're going to be partnering with them as well as we work toward integration into the electronic health record as well as the pharmacy management systems. And we're going to be using their service, which is called PDMP Gateway. This gateway facilitates communication, the transfer of information, and integration and support for the overall process of development of the API as well as the state approval process and the development that occurs as this integration is implemented. So, as I mentioned before, the real purpose of us undertaking the integration project is that it provides a streamlined clinical workflow for for providers and dispensers because it eliminates the needs for the providers to exit their electronic health record, access a separate web portal, log in, enter their patient's name and date of birth, and run a separate report. Rather than doing all of those extra steps, the EHR or pharmacy management system will automatically initiate a query. It will validate the prescriber's E-FORCSE credentials and return back a report immediately within that EHR or PMS system. So there won't actually be any additional data entry for the practitioner beyond clicking a button in most cases, because once they click that button, all of those pieces of information will be automatically transferred with the request, and that report will display back for them. We do have a specific page on our website related to the EHR integration process. As Pam mentioned at the beginning of the call, we've shared 3 attachments or 3 handouts with you all on this call. They are the EHR Quick Reference Guide, the Integration User Guide, as well as the Integration Request Form. The EHR Quick Reference Guide just sort of provides a brief overview of the process I'm about to go over with you. The Integration User Guide goes into much greater level of detail and will probably be what the health entities who wish to undertake integration will share with their software vendor. And then lastly, the Integration Request Form. And basically this form just indicates the health entity's interest in integrating. That form comes to us and we approve it, and then we send it over to APRA so that they can reach out and get the process rolling. So in terms of the integration procedure, the first step is to complete the form that I just mentioned, the integration request form. And if you do complete this form, please do be sure to identify a lead point of contact for the project, as we may need to ask some additional questions. And also that will probably be the same point of contact who will work with our vendor. Again, this form basically provides some very basic information about the health entity themselves, and then provides information about the users that they have within the health entity so that we can plan accordingly. Step 2 is that the eligible entity will return the executed interest form into the department at the address on the screen in that form as well. And we review and approve the request and send that back. And at the same time, we make a notification to our APRA integration specialist who will work directly with the identified point of contact to move the process forward. I do want to make mention here that any pricing related to the integration would be negotiated directly with APRA Health. In Florida, we are using an entity-funded model where the health entity is responsible for the cost of integration and any applicable licensing fees associated with that integration. So all of that will be negotiated directly with APRA. The third step is that the approved entity downloads and executes the Gateway License Agreement with APRA Health. This is the legal agreement that makes the connection between APRA Health and the health entity and sets forth the requirements and the accepted uses and everything that goes along with use of the Gateway system. This is an agreement that the Department of Health in the state of Florida is not party to. However, we are in the process of reviewing and finalizing that agreement with our legal office, and we'll be publishing that very shortly so that the health entities can begin completing those documents and getting those over to APRA. In the meantime, I know that many health entities and pharmacies are already working with APRA. For those of you who are on the call, your health entity's software vendor
Erica? I apologize, we're having a technical difficulty. We will wait just a minute to see if we can get her back online. while we're waiting, there's been a couple of questions about whether a copy of the information is going to be available, and it is. We are recording this presentation. Additionally, we will be sending you a copy of the presentation as well. So hold on one moment and let's see if we can connect Ms. Marshall back to us.
Hello, can you hear me?
Now we can hear you. Thank you for...
Okay. Sorry about that. I'm not sure what happened. I do apologize. So I'm just going to jump right back in. So we are currently in the process of the final stages of approving the Gateway License Agreement with Apris Health, and we'll be getting that posted and sent out to those who have already sort of begun the process. But I did just want to mention for those on the call who work at some of the larger health providers in Florida, as well as the pharmacies, many of the software vendors have already undertaken the work necessary to make these connections in other states. And so the onboarding and implementation process is fairly streamlined and straightforward. So step 4 is the actual development work, which will be done by the health entity or their software provider if appropriate. As I mentioned on step 2, once we approve the integration request form, an Apris Health specialist will contact you to confirm the details of your request and go over the next steps with you. One of those steps will be to have a technical meeting between the entity and a vendor, if a software vendor, if appropriate, and Apris Health to sort of just walk through the process and sort of set expectations of what that will all look like. And then the software vendor will actually perform the coding or development work necessary to connect to the PDMP gateway using the Apris Health toolkit, if applicable in that situation. And that toolkit would be provided directly from Apris. If the integration is already completed with the health entity's vendor, the health or the software vendor just really delivers the code to the approved vendor and the testing begins almost immediately. So it is a very streamlined process for those who have already made the connection in another state. Step 5 is testing and final approval. So once all of that development work has been completed, Apris Health will notify or will do the testing with the vendor and then notify E-FORCSE once that testing is completed. And then E-FORCSE program staff will go in and actually approve the entity within the Gateway console, and the integration process will be complete. So at this time, I'd be happy to take any questions that you guys might have. In terms of, I apologize that I wasn't able to show any screenshots, but the application itself is really going to vary on how it looks, depending upon how your software system codes the changes within your system and how your system is set up. So at this point in time, I don't have any screenshots to share related to that, but if you are interested in making a connection, then I would definitely encourage you to reach out to your IT office if that's not you, and reach out to your software vendor if it's not an internal system that you have. I also did want to just talk about possible future learning opportunities. We are going to be hosting several webinars on many different topics over the next couple of weeks related to House Bill 21 implementation, as well as probably some additional calls regarding integration. And we will post that information on our website and send it out to our system users. So I did not in my presentation today go over at all really sort of the nuts and bolts of the E-FORCSE system. If you are interested in more information, you can reach out to me at this email address and I'm happy to share it.
Thanks, Erica. We do have a lot of questions for you today.
Okay.
The first one, you had mentioned that you're going to be working with states to allow connectivity or sharing of information across state lines, and Alabama is one of those states. We did have somebody asking about Georgia and whether Georgia was close to the top of that list for connectivity.
Absolutely. We're definitely going to be prioritizing our border states, of course. So Georgia, it's my understanding, they actually just began allowing interstate data sharing. So we've already reached out to them and we'll begin that process. We have to actually enter into a legal agreement with a specific state in order to authorize that interstate data sharing to begin to occur. So absolutely, Georgia is high on the list. But as I'm sure you can imagine, with our tourist population as well as our snowbirds, you'd be kind of surprised at the states who have expressed a real keen interest in connecting. So I think it's going to be pretty widespread before too long.
Right, right. Yeah, we here at ACA realize the connection between New York and Michigan and Florida. Yeah. That's amazing. Another question, can the data that is viewed out of the PDMP be retained in their EHR system, so a provider's EHR system?
I don't believe that the law prohibits that any longer. In terms of whether that is facilitated through this EHR integration with APRIS, I believe that it is possible, but it might just depend on how the individual EHR does their development work as to whether it's retained or not.
Okay. We have a question about time frames. They're saying since the legislation goes into effect on July 1st, how long do you think it will take for integration? And can they start now?
Yeah, absolutely. If you're interested in integration, please do go ahead and go to our website or download the form from the handouts for this presentation, the integration request form. Go ahead and send that to us. You can definitely get the ball rolling. In terms of the implementation time frame, it really does depend on the individual health entity and sort of what their current status is with their vendor, if they have one. If that vendor has already made a connection in another state, then obviously a lot of that development and testing work has already been completed, and it's really just a matter of us approving them at the very end. But then for others who haven't done any development work, it's really going to be a balance with their own internal development schedule as well as with getting on the calendar with APRIS. But I would definitely encourage those who have not already completed a form but are interested, do go ahead and complete a form. We'll get that processed on our side and get you connected with APRIS. I know that there are several health entities who are already working with them and are just waiting on the approval of that gateway license agreement in order to really sort of finalize that process and hopefully begin with their connection taking effect on July 1st as soon as the law takes effect. Okay. So sorry, I can't give more specifics, but it really is dependent on the individual circumstances.
Right. We actually had someone say that they contacted their vendor, but their vendor didn't understand what they were referring to. So should they reach out to their EHR vendor or APRIS first?
I think in most cases you would reach out to your software vendor first. And the integration guide that I've included as a handout, which is also available on the website, does provide a bit of overview information that may be helpful to inform that discussion if your software vendor is not familiar with the EHR integrations. I think many integrate with other data sources, so they're probably aware of of that from a more broad perspective. But as it relates to PDMPs, I would suggest maybe sending that document along to them to sort of generate some discussion. And then certainly you can reach out to APRIS directly and they can get engaged as well.
Wonderful. And then a couple of questions about costs for integration. Do you have any information about that?
I do not. So because we're using an entity-funded model, all costs will be negotiated directly with APRIS directly. There is a licensing fee, which I believe, my understanding is that it's based on the number of users within that system. So that's why you'll notice on our integration request form, we have requested that you provide the number of users that you have at your location. So it is an economies of scale. You know, the more users you have, it's going to be less per cost user is my understanding. But again, that's all negotiated directly with APRIS. And then it's possible that your EHR provider may also charge some additional licensing fee to make that connection. So we're not really involved in any of that discussion or negotiation. So unfortunately, I don't really have any additional information to offer.
Okay. There's a question about, and I believe that this is answered in one of the documents that you provided, but someone indicated that when they looked at the data submission guide, the information, the new information was not in there. The guide,
right.
I guess,
we're
working on the website.
Yeah, we're working with our vendor to get that updated to reflect the changes that will be taking effect on July 1st. I can, for those pharmacies who are on or those dispensers who do report to us, I do want to let you know we are actually doing some rulemaking to change. Currently, all of our reporting is done in what's called the ASAP 4.2 standard. That's just the way that the information is formatted and how the fields are coded. In order to collect the permit number and the identification of the patient, we actually need to move to the ASAP 4.2A standard, which includes those additional fields. So we anticipate that rule will take effect sometime in July, and we will be giving dispensers a year grace period to make that transition, during which we'll be accepting data in both 4.2 and 4.2A standards. So the reporting of the permit or license number of the dispenser and the patient's identification, it does take effect by law on July 1, but we won't actually be doing any compliance on that reporting until a year from the adoption date of the rule. The other two criteria, the number of refills and the telephone number, will need to begin to be reported immediately on July 1st. And although the guide is not updated with that information yet, that's forthcoming. Instructions on how to report those two fields are in the appendix under 4.2. So that information is there for your information.
Okay. I also have a question about nursing homes, and the question is whether a doctor seeing patients in a nursing home and prescribing controlled substances for those individuals has to also check E-FORCSE for every time they prescribe for those patients. And that would be interesting for hospice as well.
Yes, we have received this question quite a bit over the last 3 weeks. And I believe we've determined that we're going to need to engage in some rulemaking to address this issue. So I don't have an answer for you today, but I would say that we should be publishing some rule language related to this in the next 2 weeks. And as with any other rule, the public will have opportunity to comment, but that will provide some guidance on whether that's required at that time or not.
Okay. Here is a question about the physician report card that you talked about. Someone said that they thought it was great and they wanted to know if risk managers or other administrators would be able to see something like that.
So at this point, we won't have a way to actually share it with risk managers or hospital administrators. Our law doesn't authorize us to provide any information to them, but certainly if the practitioners wanted to share that information, or if the risk managers or the hospitals wanted to demand to see it, then the provider could provide a copy of what they received to them directly.
Okay, so it would be up to each provider to share that information if they would like to, and it's really it's a comparison of them against other providers in the state.
Correct. It'll be kind of a summary of their prescribing, but then it will also be a comparison of their prescribing habits to other prescribers who have indicated a similar specialty in their registration form.
Okay, so it is separated by specialty type. Okay.
Yes.
I think we may have had this question. It's about whether healthcare entities can begin applying for integration at this time.
Yep.
And I think you said the answer is yes, please do.
Yes, please do go ahead and complete the integration request form so that we can get you in contact with APRIS and you can begin that process. It's going to probably be a few technical conversations before you actually get down to the work, so absolutely would be appropriate to go ahead and begin.
Okay. We've got more questions typed into the queue, but I do have William Del Toro, who has had his hand up. I'm sure his hand is really tired now. And so, William, I have unmuted your line. Would you like to ask your question?
No, I don't have questions. I'm listening
okay. Okay, great. I just saw your hand up, so I was just checking.
Okay.
Thank you. I'm going to mute you back. Put her hand down. Let's see. Oh, a question about timing again. Since it does take effect July 1st, do all of the agreements and testing need to be completed before July 1st?
No. So what I would say is EHR integration is voluntary. So nothing has to be done within any certain period of time. The authority for us to participate in EHR integration begins on July 1st. So we won't actually be turning any connections on until July 1. So there's no deadline for the agreements to be in place. The work to conduct these integrations will move well beyond July 1st, I'm sure, as additional health entities become interested and can prioritize getting that development work done. Of course, as always, the web portal is there for your querying, for your use to query. So until you're able to make those integrations, certainly I would recommend that. I do want to take the opportunity I'm assuming that most of you, since you're on this call, you're probably already are E-FORCSE users if you're not the health IT officer of your hospital. But up until the point where you can get integrated, if you do a pretty decent volume of prescribing of controlled substances, we do have a new report available in the PDMP Aware system. It's called Bulk Patient History, and it does allow you to run all of your patients in a single report or input the request all at once, and then you get back an individual report for each patient. But the data entry is quite minimalized, and you may even be able, if you're using an EHR, you may be able to actually even export a file in order to help facilitate that process. But that can sort of assist with the transition of the mandatory consultation until you can get into the EHR integration component.
And that's, there's another question that kind of relates to that, and that's whether a provider can pull the data for their patients the day before. So if they know their patients are coming in, can they go and do that report and have that patient information the day prior so they have it the day the patient is coming in?
Absolutely. There's no guidance provided currently in the law about how far in advance that consultation can occur. I certainly think a day or two in advance is reasonable. And I'm hoping that maybe the boards of medicine and osteopathic medicine will come out with some guidelines as part of their statutorily mandated rulemaking. So there's not a current hard, fast rule, no more than a week or whatever, but I would say within a day or two of the appointment would definitely be appropriate.
Wonderful. And then you mentioned not having Schedule 5 drugs, controlled substances not having to be reported. Is that accurate?
No. So in the past, up until this year, we have not collected Schedule 5 controlled substances, but beginning July 1st, those will be required to be reported. So that is going to expand the range of drugs that you see on the report quite significantly, I would say. I think maybe what's being referred to here is the mandatory consultation. There is an exception for Schedule 5 non-opioids. So it is very specific with that exception. It's non-opioid Schedule 5 only that are an exception from the mandatory consultation.
Okay. So if it contains an opioid, you do need to do the check. If it does not contain an opioid, it's exempt.
For Schedule 5, yes. For all of the other schedules.
For Schedule 5
right.
only. Schedule 5 only. Yes. Thank you for clarification.
You're welcome. For all other schedules, it doesn't matter the drug class. It's all, yeah.
Okay. We have a question from somebody that asks if their EHR system already has the APRIS PDMP check API, do they still have to fill out the integration form?
Yes, you do still need to fill out the integration form because we want to know who has access. And I don't believe that you still, even if your EHR already has that built in, you do still have to let us know that you're interested, as well as enter into the agreement with APRIS to actually turn on that functionality.
Okay.
So my understanding.
It's set up for the functionality, it just hasn't been turned on, is kind of what that means.
That's what it sounds like. Yeah, that's what it sounds like. I know Epic and Cerner and most of the bigger EHRs do already have that built in. So you may, as this person has indicated, you may see some sort of reference to it in your EHR already. But it's my understanding that in order to actually turn that on, you would need to definitely do the integration request form for us, and then you would need to enter into the agreement with APRIS.
Okay. We have a question about smartphones or mobile devices and whether E-FORCSE is planning to create an app for that.
So I'm not currently aware of any efforts to create an app, but I will say that the current web portal version actually does display pretty well on mobile devices. I've actually been traveling quite a bit the last couple of weeks doing outreach for all of the things that we're implementing, and have been using my iPad and phone as I'm sitting, in the airport. And it really does display very nicely. So I think APRIS is aware that there is some interest in an app. So that may be something that they are developing in the future, but it's not on my radar quite yet.
Okay. A question from a pharmacy, and they want to know how this affects them, and if they are already using the system, do they still need to apply for approval after providers are registered? I'm not really sure if I get that question.
So yeah, I guess I'll try to answer that question, but we may need to ask for clarification. I just want to remind everyone again that this integration process is completely voluntary. If you're happy to continue using the web portal, which is again provided at no cost as it always has been, that's fine. That's absolutely fine. We're just providing this integration option as an alternative, which could possibly improve efficiency and effectiveness in your clinical workflow, because you're not having to exit your existing computer system to go to a web browser separately. So there's no requirement. And if you don't plan to integrate and your users are all just registered with the web portal, there's no additional action that needs to be taken in order to continue accessing the information in that manner. And if that's not your question and I haven't answered your question, maybe you could raise your hand and we can unmute you.
Okay, we'll wait and see. We'll go on to other questions and see if we get a hand raised. Because there are plenty of other questions. Somebody wants to know if there is a list of software vendors who have already integrated with the PDMP gateway.
So I have actually just requested a list from our vendor because I thought that would be really helpful for our health entities to be able to just look real quick and see. I am waiting on that list, and as soon as I get it, It will be posted to that integration website that I mentioned earlier that's in the slides. And then I don't know if you have a place on your website, Pam, where you could post it as a resource as well, but that information has been requested.
Okay, great. Yes, once you have that, that would be great. We'll be glad to share that information. There is a question about whether dispensing provider also include retail pharmacies.
I'm not sure I quite understand the question. Dispenser would certainly include a pharmacy from the perspective of the mandatory consultation. The pharmacist would be required to consult E-FORCSE prior to dispensing a controlled substance in Schedule 2 through 5. And then from the perspective of the EHR integration, the pharmacy could participate and integrate into their pharmacy management system.
Okay. I'm looking to see. We do have a question from Luann Barrett. She has her hand up, so I'm going to unmute you, Luann. Would you like to ask your question? Luann? Okay, for some reason, we're not able to hear you, so if you would like, you can just type in your question. I also have Bonnie Sadler, your hand was raised and she took it down. So let's see if the question is typed in.
And while we're looking for that question, I do just want to say I just received an email, I think, from someone on the call. There is an underscore between EHR and integration on that link. So if you're typing it in, I just clicked on it and the link does work, but it's www.eforce.com/EHR_integration.
Okay, here's an interesting question. This is someone that has multiple providers with multiple designees that float between, the designees float between the different providers. Is there a way, once integrated, to select or change the provider under whom the designee is working?
That's a pretty technical question, and I'm afraid to say I don't know the answer to that. That would probably be something that could be determined through the integration process. I think that would be possibly dependent on how you coded it on your side. I know on the web portal, it's fairly easy to take out and remove supervisors. And of course, you get a drop-down menu at the top where you make your selection of who you're querying on behalf of. So I think that's going to depend on the individual programming that occurs for the implementation.
Okay. There's just another question about when the integration form should be filled out. I believe you said you can go ahead and fill that form out now, as soon as possible. Also, whether it needs to be filled out by both prescribers and pharmacies. And I think you've just answered that.
Yeah, I would say you might want to consult with your software vendor before you fill it out, just to make sure that it is something that you are wanting to implement, so that you're not getting bogged down with emails from us and from APRIS if it's not something that you're going to end up moving forward with. So it may be helpful. You're welcome to go ahead and submit it at any point in time, but it may be helpful to just have a quick chat with your vendor or your internal health IT staff before you fill that out. In fact, you may need to consult with them on some of the information anyway.
We actually have a question for me, or for us at least, and it is, do we need to be integrated to meet meaningful use? The meaningful use requirement right now is that you check the PDMP and you register with them as a provider that prescribes, and that you also check the PDMP when seeing patients. And since that's going to be a requirement in July, so the short answer is no, you don't have to be integrated to meet that requirement. Okay. Not related to the EHR, but why are we not able to submit the automatic report with no activity included for days where no controlled substances were dispensed, like we do when we do have activity?
It's my understanding that you should be able to submit a zero report. I believe what you're referring to is the SFTP transfer. If you'll email me directly with this question, I can try to facilitate figuring out why that's not working for you. But it is my understanding that as part of our adoption of the ASAP 4.2 standard, that's part of it is the zero reporting through the SFTP site. So I'm happy to research that issue further for you.
Okay. Another question, our practice is pediatric oncology, hematology. Patients that rarely are prescribed opioids do we still need to participate in E-FORCSE? And so if you have patients that are 16 or older that are being treated.
Right, so mandatory participation or consultation would apply to those patients in your practice who are over the age of 16. If you don't have any patients over 16, then it doesn't sound like you need to participate, but that's going to be prescription dependent.
Okay. Can I get you, we do have a couple of questions about the next time learning opportunities are going to be available. So if you could repeat that for us, Erica, where they can get that information.
Yeah, we don't have anything that we have actually scheduled at this moment. We are working on developing a couple of additional webinar opportunities for users over the next couple of weeks as we lead into implementation, but that will be posted on our website at eforce.com. I think most of it will be geared toward healthcare practitioners, so there'll be a link there on the healthcare practitioner page. Anything EHR related would be under the EHR page, and we'll share that with you as well as send out a notification to our users.
Wonderful. I think a lot of the next questions you covered, regarding those EHR systems that are or have connected with APRIS and other states. Erica is working to get a list of those. Once that list is available, it will be posted on the E-FORCSE site, and she will provide it to us here at the Agency for Healthcare Administration for us to share as well on our sites, and we'll get that out to as many people as we can. Somebody has a question about designees as related to the integrated software. They say that they thought they read that designees could not access the integration software. Is that accurate?
I'm going to need to request some clarification. I've actually read two different things. It was my understanding that there was designee access, but I actually just read something yesterday that led me to believe the opposite of that. So let me take that question away and get a definitive answer. I thought that it was possible, but I need to double check that. Okay.
And so, Sherry, if you and the other person that asked that question, if you guys want to connect with Erica at the email address, specifically, the Gateway License Agreement, somebody said, where can they find that agreement?
That will be on the EHR integration page. We're in the very final stages of getting that approved through our legal counsel, but that will be on the website, I think probably within the next week. Excuse me. It'll be on the site here. And again, that's an underscore between EHR and integration.
Okay. For those of you, I do have a couple of people that said they missed the first half of the call. This webinar is being recorded, and so we'll provide that information, a link to the recording to you so you can catch up and see what was on the first half of the call, as well as going through the question and answer segment so you can hear the answers to other questions and probably some of your own. We are getting very close to 1 o'clock, so I'm going to ask and see if we have anybody else that has a question. It looks like we might have one from Sanjeev Kumar, and I am, Sanjeev, I have unmuted you. Did you have a question? Okay, apparently not. If there is a question, any other questions that you may have, of course, you can go ahead and email Erica directly from the email that is provided or was provided through the webinar. We do want to thank you, Erica, for providing us with this wonderful information, and all of you who joined us for the call. We really appreciate it. Any questions that we received from you will also forward on to Ms. Marshall, and any questions that we go through and we see did not get responded to within the time allotment, we will work to try and get an answer for you from Erica and the team at E-FORCSE and get back with you as soon as we can. Thank you again and have a wonderful day. Erica, do you have any parting words?
No, thank you so much for your time. And like Pam said, if you have any additional questions, please feel free to email me. I'd be happy to answer them for you. Thanks again for your time and have a great afternoon.
Thank you so much.